All new at 5:30, an I-Team Troubleshooter investigation revealing thousands of dollars worth of medical supplies sent to seniors. Supplies seniors are telling us they didn't order, ask for, or even want.
Yeah, and it turns out these are medical supplies we as taxpayers are all paying for. Diane Wilson looking into this story for months, here tonight with what she's uncovered. Diane?
You know, this all starts with a phone call about chronic pain, and you may qualify for medical supplies covered by Medicare. The end result, check this out. You could end up with a box full of medical supplies just like this, filled with knee, wrist, ankle braces. These were all sent to just one senior citizen.
I said, what the devil? I ain't order no braces. The doctor ain't order no braces for me.
But a box full of medical supplies is what Berta Pigney got.
They've not only sent you one, but two, but three. You only have two ankles.
And what am I going to do with three?
At 88 years old, Berta admits it takes her longer to get around, but says she doesn't need all of these knee, ankle, and wrist braces. Plus, when it comes to her doctor that she says she regularly sees,
I asked him about braces and stuff. He said, right now you don't need it.
So how did Berta get these medical supplies? She says she gets constant phone calls about her qualifying for braces since she has Medicare. When she gets the unwanted calls, she says she tells them she doesn't want the braces. But still, 3 different shipments arrived at her home in just 7 days, all prescribed by different nurse practitioners or doctors.
They don't know me, never seen me. I have never met them. So who are they?
We went looking for one of the prescribers and found nurse practitioner Stephanie Holcomb working out of her Washington, D.C. home.
I'm Diane Wilson with ABC 11. We're looking.
Holcomb was the first to prescribe a heel stabilizer and an ankle brace for Berta.
Do you know how your name's getting on these orders?
Yeah, so I work for a telemedicine company.
Okay.
And so I have patient prescriptions for those.
Holcomb couldn't talk about specific patients, but says telemedicine is done over the phone, but adds she doesn't make the cold calls to people like Berta.
To be honest with you, every company functions differently, and I work for several of them. And so these are internal employees that actually do the calling.
Holcomb says once those internal employees pass the patient's information and medical needs along to her, she writes prescriptions based on those assessments and can also reach out directly to the patient, like Berta.
And I call her directly, just as a responsible provider, to actually say, so tell me, let's go over this again. Like, tell me what's happening with your ankle, for example. Will a brace help?
When I showed her the other 2 orders for Berta that were not prescribed by her and were fulfilled by different companies.
That's not right. It's not normal. I don't know how it happened. I just know that when I receive the prescription, I do my due diligence as the provider who's responsible for the prescription.
Trying to get answers from the other 2 prescribers, we went to the address listed for the doctor who ordered 2 knee, 2 wrist, and 2 ankle braces for Berta. We couldn't find him listed on the doctors in the building, and when I called the number listed for him, I left a message, but no callback. When it comes to the second nurse practitioner who prescribed a knee brace and suspension sleeve for Berta, she also couldn't talk about specific patients, but said she was concerned with how many braces Berta got in a short time and that the system they use must not be communicating correctly and she would report it. And Berta isn't the only senior who says they got medical supplies they don't want.
We hadn't ordered nothing. We had in the last 12 months, I bet you had 10, 12, 14 calls about back braces, knee braces.
Endless calls about medical braces to Raleigh resident Emmett McGee's home, resulting in a back and 2 knee braces along with suspension sleeves.
So you don't want these supplies?
No, heck no.
Emmett's niece, Sandy Wilson, got involved right away.
I asked who ordered the products, and they said his doctor. And they gave us the name of somebody I've never heard of, don't have a clue where they are, nothing about the person. And I was like, that's not his doctor.
According to the paperwork, Linda Heinz, a nurse practitioner in Belmont, North Carolina, prescribed the braces.
No, I ain't never seen no doctor about that.
According to the paperwork, Heinz justified the prescription in her exam notes. It states McGee complained of back and knee pain and wanted to use an orthotic brace. It goes on to say McGee said it was a 10 out of 10 for knee and back pain. But check out what is also in Heinz's exam notes. It states Emmett is a female, 65 inches, and weighs 120 pounds. Plus, it goes on to state, quote, as a result of my examination of Miss McGee relative to her back pain complaint, I'm ordering the following back brace. Remember, this is Emmett, clearly not a female.
It looks to me like it's just an intentional ripoff.
Sandy filed a complaint with the North Carolina Attorney General, and the company that sent the braces defended their order, claiming Emmett told their enrollment specialist his desire to obtain back and knee braces from the company, plus Heinz's prescription and examination notes, who they claim is Emmett's treating physician. When I talked to Heinz for clarification, she would only provide this statement that said, I work with a company that provides telemedicine evaluation and services to patients only upon that patient's request. Due to HIPAA regulations, I am unable to comment on the care or treatment of any individual patient. As for the braces, Emmett's niece sent them back, but Medicare still paid.
They billed Medicare $3,150 and Medicare has paid $2,300 of it. So it's obviously Medicare fraud. Our tax money is paying that.
And our taxpayer money also paying on Berta's case, as Medicare paid more than $2,700 when it comes to all of these braces she got.
What's wrong with Medicare? They should have picked it up, something that's going on.
As for Medicare, a representative said they are aware of the ongoing scheme and we are working with our contractors, law enforcement, and other stakeholders to address the matter where appropriate. After Sandy filed a complaint with the state, the company who sent the braces to Emmett did refund Medicare. But Sandy says her fight is not over.
That was the biggest reason for me calling you, is because I'm thinking if it's happening to them, it's happening to hundreds or thousands of other people.
As for Berta, her family says they did report the supplies as fraud to Medicare, but the calls haven't stopped.
Believe it or not, they called me a couple of weeks ago about braces. I said, I don't need no braces. And I hung up my phone. So I'm looking to see braces come again.
And if you can believe it, Berta got 2 more boxes of braces. Since we talked with her, she said she did send those back right away. The bottom line, there are so many companies involved in this. Out of everyone we talked to, no one would admit to the cold calls to seniors about the braces, starting with them. The best advice, if you get one of these calls and you don't want the braces or need them, hang up. Do not provide any information to them at all. Instead, talk to your own doctor about your needs.